Hi everyone, welcome back to the Brown Girl Health Podcast. My name is Shivani.
My name is Ameek.
And we're the hosts of this podcast. I would like to encourage you all to join the Brown Girl Health community by following us on Instagram and Twitter and subscribing to our YouTube channel. Our Instagram handle is at brown.girl.health and our Twitter handle is bghtweets. Both our Instagram and Twitter are linked in the descriptions, and we really hope you'll join.
All right, so in today's episode, Shivani and I will be talking to Gagan and Aman. Gagan is a genetic counselor assistant at the University of California, San Francisco, and Aman is a second-year genetic counseling student at Sarah Lawrence College in New York. And you could also find her Instagram at Aman Overshares. So, hi Gagan and Aman, welcome to our podcast, and we're so happy to have you here today. To start off, can you tell our listeners a little bit about yourselves?
Hi, I'm Gagan. I'm currently working as a genetic counselor assistant at UCSF. I've taken a couple years off trying to explore the genetic counseling field. I've worked in a cancer genetics group as a volunteer. I did some behavioral therapy, and now I'm currently applying to go into genetic counseling school. So waiting to hear back now too.
My name is Aman. I am a second-year student at Sarah Lawrence, and I'm originally from Toronto, specifically Brampton, if anybody knows where that is, from Canada. And I graduated from the University of Waterloo with a Bachelor of Science in Biology and Psychology in 2019. And then I started at Sarah Lawrence right after graduating. So I had a lot of experience while I was still completing my undergrad with genetic counseling and crisis hotlines and things like that. And I'll be graduating from this master's program in May, so a few months away. So I'm currently actually applying and interviewing for jobs at the moment.
That's really exciting. So out of curiosity, does the certificate translate between the US and Canada?
It does. A lot of Canadians actually do end up coming to the US to get their degree because the programs are very limited and very competitive in Canada. And once you have a degree, you just have to write the board exam and you're eligible to write either the Canadian or the American board exam.
Oh, I see. Okay, that's really cool. So I guess my first question to both of you is, would you be able to tell our listeners a little bit more about genetic counseling, what genetic counselors do, and what made you decide to pursue a career in genetic counseling?
Yeah, so for me, I kind of enjoyed my genetics course, and I found out a lot about genetics that I didn't know about before. So that was the main, kind of driver for me. And I was always interested in the healthcare field, but I didn't know where exactly I kind of fit in. I really liked doing teaching. I liked working with kids, and I really wanted to have more of like a personal connection. So for me, I went to a panel of health professionals, and one of them was a genetic counselor, and she talked about how she kind of counseled a family who has lost a newborn child recently and kind of rebuild their lives and, give them hope that, things will be better and, they won't have to be as concerned. So that was kind of an eye-opener to me. And then from there on, I just started researching more about genetic counseling, and it just felt like a really good fit of my personality and things that I already enjoyed. So that's kind of how I found about it.
Yeah, and similar to Gagan, I guess I was also really interested in healthcare the entire time. Basically, when I was 13, I decided I want to be a neurologist. And then I went to undergrad and I decided medical school is not really what I want to do with my life. So for the first couple of years, I was really uncertain about what path I wanted to pursue. So I ended up going to a career counselor at our campus center, at our career center. And they made me do a bunch of personality tests and then told me to Google careers. So then I went home and then I Googled careers and I found genetic counseling, and I'd never heard of it before. So I got really interested. I reached out to a lot of genetic counselors, did a lot of informational interviews, and then luckily I was able to kind of do a GCA role for 2 cancer clinics in the Toronto area. And I just became more and more obsessed with it. And then I was able to get in right away, which was pretty exciting.
That is really exciting. I think something like coming from like a South Asian household is like there's only medicine and there's only like doctors, and like I remember entering college, like I was also kind of like I don't want to be pre-med, and then I saw that there was so many more opportunities, and I think genetic counseling is not one that I actually even heard of from the start, and like now that I think about it, like I wish more people knew about it. Especially like just because like things that I've seen within the South Asian community and health disparities is just surprising. So it's amazing that both of you are in this field, and like I think both of you connected through Instagram, right?
Yeah, I actually follow Aman on her YouTube channel, and she was talking about genetic counseling, and I just kind of felt like, there's another Punjabi person that's in genetic counseling field, so it's just nice to see, and I wanted to connect with her that way too.
Yeah, there's definitely not a lot of us out there, so.
Yeah, no, that's amazing. I don't know any other Indian genetic counselor, let alone Punjabi, so I find that very cool. So yeah, this is really interesting. So what exactly is genetic counseling? I know both of you talked a little bit about like shadowing. Gagan, you talked about like a newborn child and how that has to do with like in an infant sense, and then and you talked a little bit about cancer. Does genetic counseling like split? Like, are there specialties in that sense, or is it like a general thing? How do you, and even education wise, like how do you like learn about like all of this stuff?
Yeah, so genetic counselors are like healthcare providers that are trained in genetics, but genetics can actually be broken down into many different specialties. So I would say the top three, the most common specialties are cancer, pediatrics, and prenatal. And then after that, there are a lot more that have been developed. So there's now cardiogenetics, neurogenetics, metabolics, research, clinical trials, things like that.
So within these specialties that you just discussed for genetic counseling, is there one that you are more inclined to join or one that you're interested in?
I can say that I've been applying to prenatal genetic counseling jobs, and either just prenatal or prenatal and something else. Typically it's prenatal and cancer. And I think I've just always been really interested in women's health. Even when I was an undergrad, I took a lot of women's health courses, and I've just been a really strong feminist my entire life. So having the opportunity to really empower women to help them make autonomous decisions is something that I think I'm pretty passionate about.
All right, so I think something that I was really curious about is I took general bio last semester, and we kept talking about all these genetics diseases. Is that something that you have to memorize when you're like learning to become a genetic counselor, or are you allowed to like look that up? Yeah, because there's so many of them too, so I'm just very curious.
Yeah, there definitely are a lot of conditions to have to keep in mind. For the board exam, you do have to memorize a lot of things because you have to pass the board exam to become a certified genetic counselor. But I find that once you enter a specialty and you have more of the hands-on experience, you're not as strong in the other aspects that you're not working in all the time.
Yeah, for me, I work in a pediatric and adult genetics clinic, so it's just like a general genetics clinic. So it's you can see a variety of indications. So just for me, for learning, I do like to look into what the conditions are, because a part of my job is I have to look over referrals. So, but again, like Aman was saying, like the it's so broad that, you kind of like hone in on that. Because for me, like I kind of forgot about cancer genetics, but I'm more like in tune with the pediatric and adult genetics clinic now. So I'm trying to refresh before I start to school later on.
That's really cool. So what exactly do you expect, like when you start school? Like how does the education path even like work for genetic counseling?
Yeah, so anyone that's interested in becoming a genetic counselor, you have to have a bachelor's degree, and the degree doesn't necessarily have to be in science, but there are some specific prerequisites that you need to accomplish before getting into a program. So there are people who have many different types of backgrounds and still end up in genetic counseling. And then once you have your bachelor's degree, you apply to a master's program, typically a master's of science in genetic counseling. And then once that's complete, you're eligible to write the board exam to become certified.
That's really cool. So Gagan, I know you took like a few years in between like this undergrad and master's degree, and you were like a genetic counselor assistant. What exactly is the difference between being an assistant and like being a genetic counselor?
Yeah, so being as a genetic counselor assistant, you are working more hands-on in clinic of, ordering tests, doing a lot of admin work and, testing coordination for a lot of patients. So in this role, I get to work, directly with the doctors and the genetic counselors. So I've gotten a little bit more of a hands-on experience before I wanted to apply to school. So that's the reason why I took more time off. And a lot of people that do apply for genetic counseling schools, some do, like Amin, go straight from undergrad, and a lot also take several years sometimes to apply later on.
Would you say there's like an average age for entering genetic counseling, or like from what you've seen in your class, do people tend to go straight out of undergrad? Do you see more like gap years?
I would say that it's very, very common to take years off between undergrad and grad school. My class currently has 26 students, which is the largest program in the world. And we only have 4 people that came straight out of undergrad, and everybody else is all at different points in their lives. We have people who are doing this as a second or third or fourth career. There are people who have children. There are people whose children have children. So it's really people from all different walks of life, which is really interesting.
That's so cool. So 26 students is the largest program in the world.
Yes.
Oh, wow, that's insane. So is there like a shortage of genetic counselors?
Yeah, there are definitely not enough genetic counselors for as many people that need genetic services. So over the past few years, we have been growing our programs. So I believe in the US, there's over 40 programs now. And just as a comparison, in Canada, there's only 4. So it's really interesting how much genetics is needed and how much of a shortage there is of genetic counselors.
That's insane. I'm very shook from this, the statistic, because I know, for example, my mom had breast cancer last year, and the first thing that they did when she was diagnosed is, before any treatment or anything, was go to a genetics counselor. And that was actually the first time I realized this is she had her own office in this clinic, and I just noticed this position because that wasn't something that we've ever had to go to before. Which is a problem. I wish that was something that she got to see before, because maybe it would have been preventative. But that's really interesting. So I just assumed it was just something that you see in every hospital. Is that not the case?
Yeah, I mean, even for me, in the Bay Area, we're only one of 3 big genetic clinics, you could say, in the area, and we're covering all of Northern California. So you can see a lot of patients from a variety of backgrounds and, also conditions. So it's really small. And even in our clinic, we only have 1 genetic counselor in the pediatrics and 1 in adult. So it's really small, but a lot of people need services though.
So do you ever feel like you're overworked, or you've seen genetic counselors being overworked? Because that just sounds like a lot of a huge quota of people to work with, and then not enough staff to hit that number.
Yeah, I mean, personally, yes, it's a really busy clinic. It's you have a lot of things to keep following up on and making sure people are getting, their genetic testing and the right care. So you really want to work and help these people. But again, it is really, it's stressful at times, but it's all worth it, I think. So
that's amazing. And then I guess something else that just came to my mind is when you work with each patient, how long do you spend with each patient? Because from what I've seen with my mom was they made a whole family tree with family members I didn't even remember, haven't seen in so long, and there was very specific information regarding the cancer that she had, and they were mapping it. So how long does it take per patient?
Yeah, I would say typically an appointment is anywhere from 30 minutes to an hour. And that's actually one of the things that drew me to the profession, is that you really have the opportunity to sit down with a patient, get to know their own medical history, their entire family history, and you kind of get to build that connection with them. And sometimes that connection can even be long-term. You might meet other family members to get testing. You might be able to meet their children, their grandchildren. So you really have the opportunity to foster those deep connections with your patients.
That's really cool. I think it's really rare because there's something in like you see in healthcare now. There was a term that I just heard, and it's called like McDonaldization of healthcare, because like you want to see because like doctors, especially with telehealth, right? Like people just want to see patients so quickly, and like you can't just sit down and like have that time with patients because you want to just quickly like finish and give them whatever they need. And I think that's something I really valued when I was thinking like pre-med or anything, just being able to talk to people. So in general, I know we a little bit talked about what you do with patients, but like, what is it like? Like, what is, I know like y'all aren't actually like a counselor just yet, but like, what have you seen, I guess, while shadowing, or what do you expect to see when you finally get to that role?
Yeah, I would say that I have quite a bit of experience since I'm a student now. So in our program, we do have to have clinical placements or rotations, and you have to have them typically in pediatric cancer and prenatal, and then you can have extra as well. So I'm currently on my last set of rotations, which is in prenatal. And the process looks pretty similar across the specialties. You'll typically get a referral, and then you'll meet the patient, ask them about questions in their medical history, take their family history, and then you can talk about different testing options depending on their needs. And then obviously explaining what the test is and what the results could look like. And then you would have a follow-up with the patient. So in cancer, like you mentioned, if somebody has a history, a personal history of cancer, especially if they were young or it's a rare cancer, they might need to see a genetic counselor, or if they have a family history of related cancers, such as breast and ovarian or uterine and colon. And then in prenatal, we see a lot of individuals who are pregnant over the age of 35. That's when there is an increased risk of chromosomal anomalies like Down syndrome. So there is additional testing or screening that we can offer them. And then in pediatrics, I guess Gagan can also speak to this, but a lot of the times it's children who have developmental delays or autism or epilepsy, or even a lot of different things going on with their medical history. And we just want to check if there could be a genetic cause of that.
So I guess kind of just going off of that in terms of patient cases and things like that. I know in our biology classes, we always hear about, these crazy cases, and we make pedigrees and like Punnett squares to figure out how the offspring are going to look. But I was just wondering, what is probably the most fascinating case you saw, or the most interesting case that you've shadowed over the years?
I mean, I've seen a really meaningful genetic counseling appointment where a girl that was around my age actually was being referred for a condition called spinocerebellar ataxia. And a lot of her family members have passed, and she's kind of the only one that was left. So she wanted to go in and get genetic testing. And she was pretty stoic. She was just like, I need to get the testing done. I just need to get the testing done. And the genetic counselor was kind of trying to reassure her and try to seeing that she has the support that she needs before, going into the testing. And if it does come back positive, making sure she understands what that actually means. So she really kind of geared the conversation about just only having the genetic testing, but more into the conversation about what kind of support she would have. Because again, she was living by herself, but at that time, her boyfriend came along with her to the appointment. And then when we followed up with her, she did have a positive report. But she also took that information that the genetic counselor kind of told her about the support, and she talked to her boyfriend, and they actually are engaged, and they, wanted to at least have something done before they found out about the report, regardless if it was positive or negative. So that was just really nice to see, and, really, I don't know, something really meaningful. I mean, that was something I've never seen that before, or a genetic counselor kind of have that big of an impact. So that was really special to see for me.
That is really special. That's so cool. And I think that's a very when you have something so meaningful, then I'm sure that that just makes your passion to go into the field like a lot more solidified. And I'm sure genetic counseling has like such a huge impact. Like back to my mom, I remember when we got like the results and stuff, it was a very big game changer in terms of what treatment to pursue and like how to feel about having this cancer too, because it's a very big thing. Yeah, that is amazing. And do you have any other meaningful stories as well?
Yeah, I was just going to add on to what Gagan said. Like, if somebody does get a positive result, like this person did in that case, there's also an option of doing IVF or PGT for future generations. And that's definitely an area that is increasing, and genetic counselors are involved in that process as well. But in general, I would say that the types of cases that really stick with me are the ones that have a lot of counseling to it. So people that have interesting family dynamics, or sometimes genetic testing can tell us things that people don't expect. So for example, one of the pediatric cases that I saw, we did a trio whole exome, which is basically taking the genetics or taking a sample from someone's mom, dad, and the child. And in this situation, just to simplify it a little bit, we ended up seeing that the dad's DNA was actually not a match for the child. So that's a case of non-paternity, but it was complicated because the caregiver for this child was her paternal grandmother. So there are very complicated nuances of genetic testing, and it's really important that patients are aware of what they're getting into before they consent for the testing, because a lot of people never expect that would actually happen to them. So just being able to have conversations with family members, sometimes multiple family members, talking them through how complicated genetics is, I think that's what really sticks with me.
So when you started having these sorts of conversations, and even as a student, when you had those clinical rotations, was there something that was taught to you on how to do that, or was that very experience based on how to improve giving those conversations?
Yeah. So in our program, at least, the first year is really about learning in the classroom, learning from a textbook, watching other people, observing genetic counselors. And then in the summer, we have a full-time 40-day placement, and that's where you really get to develop those skills. And then most of second year is based on the hands-on experience. So you get to go into clinic. You actually, I would say you're in clinic half the time, and then you're in a class half the time. So they want you to have a solid understanding of the actual genetics and how a genetic counseling session would look like. And then they let you kind of explore that, see what styles you like, and how you can explain different things to different people, different patient populations, different specialties, all of that.
Is there something specific that you learned maybe about a South Asian population, or just in general women?
Yeah, I have to say in the area that I'm in, I haven't actually seen a lot of South Asians in the patient population, but we definitely get a lot of Spanish-speaking individuals. We have people, many, as you can imagine, the New York City area is very, very multicultural. So in the summer, the placement I would have been at, if it wasn't for COVID, it would probably have had a larger South Asian population, because that's the area that I grew up in. But unfortunately, I haven't been able to experience that. However, in the future, the jobs that I'm looking at, I'm really, really interested in working with diverse patient populations, specifically underserved populations. So I'm trying to gear my job search towards that as well.
So with COVID, and Gagan, you can answer this as well, how has genetic counseling changed, or has it even changed at all?
It's 100% over telehealth. At least for my clinic, we don't have any kind of expectation that we're going to go into inpatient clinics. Again, I think there's, a pro or con to that, because again, we do have a lot of, patients that we need to see. Again, telehealth is a little bit of an easier option instead of people traveling to San Francisco. But yeah, it's been working out well. But again, I feel like there's a little bit of a disconnect on the person to person kind of contact too.
And Aman, how about you? You mentioned earlier that your placement had changed, but how has it been in terms of the educational side?
So I've been in clinics that have both done telehealth and in person over the last year and a half. And it's really interesting. Sometimes it can be really flexible depending on what the cases are in the area. So you might be in person one week and the next week you have to shift to telehealth completely. But if I'm being honest, it was really hard when things got pretty bad last year in March, and then we had to shift completely online. A lot of our rotations were canceled or put on hold indefinitely, and we had to really be very flexible with the time that we had here. But I'm still very grateful, even if my opportunities were telehealth, because there's still a lot you can learn. And interestingly enough, one of my rotations before COVID was just a telehealth company. So I already had some of that experience. So I kind of had like an upper edge in that aspect. But like Gagan was saying, telehealth can be very helpful for a lot of patients because you can be in your home, you don't have to take a day off work, you don't have to have transportation costs, but there's also a downside to having that disconnect of talking to someone on the phone or over video rather than in person.
For sure. So do you think after COVID, like especially for genetic counseling, like telehealth is still going to be like a service that will be a lot more invested in?
I definitely think there will be a shift towards telehealth because a lot of what genetic counselors do is just getting information from patients and explaining things to them. So we don't actually really need to do a physical checkup. And pediatrics is a little bit different because the geneticist does do a physical, but in the other specialties, you typically don't need a doctor to do the checkup or anything. So I think telehealth will maybe, if not take over, but kind of be an option for patients.
So you mentioned that pediatrics requires the physical and other specialties don't necessarily do that. Is there a specific reason for that?
Yeah, so in the pediatrics, a lot of the, kids that we see, they have, different kind of congenital anomalies or differences that we'd want to see throughout the body. So a lot of the genetic conditions that we do see in kids, we want to at least obviously the geneticist would be looking for those things. So yeah, even that we're doing physicals over telehealth. So it's interesting. But again, yeah, there is that additional aspect just because, with the pediatric population, there's a lot of different genetic conditions you are trying to look for.
I personally haven't been to a genetic counselor before and don't know many people in my life who have either. For people who have never been to genetic counseling, at what point should they consider scheduling an appointment?
Yeah, so there are a couple of reasons why somebody would consider seeing a genetic counselor. One of them is if you have a family history of something. So for example, cancer or any other condition that seems to be running through the generations, it might be important to consider seeing a genetic counselor. Additionally, if anyone has a personal history of things like cancer, especially at a younger age or rarer cancers, and if you were born with any congenital anomalies or you have a genetic condition, definitely. And also, I think more recently it's becoming prominent to get carrier screening. So if you're considering getting pregnant, it's important that you get tested for a lot of autosomal recessive conditions and then have your partner tested if possible as well.
So that's really interesting. I think that at least I've never really known this fact, and I think that's really important to keep in mind. And I'm sure our listeners, a lot of them are young women, so that's really important to know as well.
Yeah, and I completely agree with you, Ameek. I think that this is extremely important information. And just to go into a little bit more detail about appointments, I guess if I were a patient who wanted to come in for an appointment with a genetic counselor, what should I expect from my first appointment? Do I need to bring a full family history with me, or can I just come in with some information about my personal condition?
Yeah, well, I guess I can add on the clinic side, we try to get questionnaires in where, we request that families do provide that information. But again, I think during our appointments, we can actually, when we're kind of proning and asking our questions, you can find out a lot more about families than they might have noted on a paper. So yeah, we request that the families come in with a good idea of what the family history might be. And we usually request for a lot of additional records, especially on the pediatric and adult side, because we're seeing such a big array of people and we want to make sure they're being seen by the right providers.
Oh, okay, that makes sense. And so I guess my next follow-up question is, we've seen many times how genetic tests and genetic counseling carries a lot of stigma within the South Asian community. And so, as aspiring South Asian genetic counselors, what message do you both have for others within this community when it comes to tests and counseling?
I would say, first of all, people don't know what genetic counselors are, and a lot of people don't know about the genetic services that are available to them. And I think part of that has to do with the fact that our field is so new. Genetic counseling as a whole is about 50 years old, so it's not as well known in the medical community either. And I think the second thing that's really important that I've been reflecting on a lot in the past couple of years is how I think in our culture we tend to put things off a lot in terms of our health. So people don't go to the doctor until they're really sick, or we don't take a lot of preventative measures in taking care of ourselves. And a lot of genetics can be preventative. And I think it's hard to kind of put yourself first sometimes when we have a lot of other things going on. As a community, we put a lot of emphasis on many other aspects of our life and then put ourselves last.
Yeah, I think I wanted to add on to that because, personally, I've been telling people like I'm really interested in going into genetic counseling field, especially like my dad's friends and things like that. But they're like, oh yeah, but you should just consider being a doctor instead. I'm like, well, no, I personally chose this because of a reason. And it's really fun to see my parents as well try to explain genetic counseling to other people. I think initially they were it was pretty not so great, but then they've gotten a lot better now that I talk to them more about what I do in my work. So it's really cute to see too.
That is really cute. That's so nice. So I guess another question I had was like, I'm especially even like working at UCSF, right? There's a huge diverse patient body, and like I'm sure there are like language barriers, not just with South Asian communities, but with like other ones as well. And I know Aman mentioned like Hispanic speaking populations being from New York City. So is it easy to work with like interpretation services when you're having these telehealth appointments? Because something I've noticed at least was like having a third party sometimes just really changes like that communication when it goes through you, this interpreter, then the patient, and then the patient interpreter to like you.
Yeah, I mean, I think at least technologically, we definitely got like, the phone service, which is really helpful. So whenever we're trying to call patients, we just dial up that number and they're really interactive. But it's really funny. I was talking to one of the geneticists I work with, and she's of Asian descent, and she had a interpreter on the line, and she was like, you know what the interpreter was saying was not 100% of what I was trying to say. So I think sometimes there's things that do get lost in translation, but it's the best we have so far, especially with the phone interpretation. But again, it could definitely be a lot better.
When like working with like in Brampton, I guess like when speaking with like Punjabi folks, is there like specific new vocab words that you've learned from the process, or like how do you explain genes? I'm very curious.
Yeah, I think about that all the time because number one, like nobody in my family knows what genetics is. I just like say I'm part of like the healthcare team, but sometimes like I haven't had the opportunity to ever counsel in Punjabi yet. So I'm really interested in doing that if I ever have the opportunity. But when I can't fall asleep, I try to rehearse things in Punjabi in my head because I'm like, how would I say this? Like, how would I describe this? And also a lot of the things that we ask about in terms of like family and medical history are topics that are taboo in our community. Like we ask in prenatal, at least, like we ask about miscarriages, we ask about stillbirth, things like that. And even in general, in my family, at least in our culture, we don't talk about people who have health problems. Like if somebody has cancer, like you can't tell anybody about it. So there's a lot of hush hush. So I think that's also really important to consider in terms of like the cultural humility and the different things that different groups of people experience.
Cultural humility is like a huge one. It's really nice to hear that. Like that's something that like I learned that in a very social justicey class that like didn't even have a lot to do with medicine, and I just found that very interesting as well. And that's really interesting that you bring that up with all the stigmas, especially like miscarriage. I'm very like interested on like how like you probably have these conversations then too with patients. I'm sure that takes a little bit of like effort to get in that information too, because I know, especially when I saw like cancer in my own household, like that definitely was stigmatized in terms of like my mom not wanting to tell people, and then like when you find like a certain subset of other aunties who had the same disease, like they kind of stuck together as well. So there's that. But yeah, that's really interesting. So you also mentioned like in terms of like South Asians, they wait very last minute, like when it comes to things like this. So is there any way to like, and I know you mentioned like specific times when you should be going to genetic counselor, but is there any way to like genetically screen for some of these conditions like early on to minimize like the severity of these health conditions as well?
Yeah, so most states do have newborn screening panels. They do. So when any child is born through a hospital, they have like the what's it called, the toe prick, the heel toe test. And different states test for different things, but a lot of the really important or really severe conditions are tested for at birth or screened for at birth. And that way we can catch early on if somebody is at risk for a certain condition. And like I said, carrier screening is one of the other ways to screen people for conditions. It's not as common because it's not required for individuals, but it's highly recommended that anyone who's considering starting a family gets screening just to see if they are a carrier for a condition and if their partner is a carrier for the same condition, because then they have a 25% chance of having a child with that actual condition.
That's really interesting as well. And like just to like another question that was asked from our listeners was based upon like South Asian genetic data. And I know we've also mentioned earlier that there's probably a significant lack of this data as well. So how does this influence the way that you counsel your patients, and how can this genetic data be built over time?
With more people getting testing, I think it's the main reason why we need this, because to be honest, we in genetic counseling or genetics field in general, we are kind of lacking that data of just any other minority, but we're testing a lot more of Caucasian people. So I think making it more aware in our community is really important, and that's how we can increase it, because you can find a change in, a South Asian person, but we can't really interpret that change because it might be a new change that was found on their report, but maybe no one else had that change. So it's like, so how do we counsel? It's kind of a hard conversation, and we just try to at least track it in the family. At least that's what I've had in my experience. I don't know if Aman has the same kind of experience as well.
We definitely get a lot more uncertain results for people who are not of European descent, just because all of our databases are based off of the European populations. So it is definitely a challenge that I've seen some of my supervisors like tackle head on before somebody gets testing, and then I've seen others explain it when they get the results that are uncertain. But it's definitely something that I am pretty passionate about giving people the knowledge before they even pursue a test, to know what they're getting into, because even though the test might be uncertain right now, as more people get tested and we build that database, it's possible that result might be reclassified to something that's more meaningful in the future.
For sure. So I guess something that came into my mind was like services like 23andMe as well, and like the genetic databases that they probably use are also very European or Eurocentric as well. And I do have like a Punjabi friend actually who got the exam done, and it was funny because it was like 99% was like from North India, and then there was like actually 98, and then there was like 1% was like some random part of South India, and then 1% was like Middle Eastern. So I don't know how true those results were, but yeah, what's your take on services like that?
I think, it is not it's not a diagnostic test is basically what it is. It's like if you're healthy, you want to find out about your ancestry, sure, you should think about it. But, it's also important, at least in the cancer field, they do check for like certain variants or changes. But again, people also get a false reassurance from those reports saying, oh yeah, I already got tested for, breast cancer, BRCA or something like that. But again, they're only checking for certain changes. So again, it's not diagnostic at all. So we do also get a lot of referrals for people doing 23andMe testing. But again, it's not 100%. But again, a lot of people do it for fun. That's my take on it, at least.
Would you ever get it done just for fun?
There's also additional concerns. I feel they do have a big database, and it's also what do they do with that information is a whole nother conversation. So me personally, I don't think I would do it.
That makes sense. I did just hear from that same friend that there's like a health addition to 23andMe, and like you can get those screenings done. I think that's really important note to make. Then like don't take those like 100%. Like still like look into it more. Aman, would you take the 23andMe exam?
Personally, I don't think I would. I mean, if I had extra money lying around or somebody wanted to buy it for me as a gift, sure. But like Gagan was saying, I wouldn't take it for any health purposes. Like if I was just interested in finding out if I have a salty or sweet taste or something, sure. But yeah, it should definitely not be used for medical purposes or medical reasons. I do see why people are drawn towards it because it is so accessible and it is affordable. And that is a barrier for a lot of people. I completely understand. But their testing criteria and their labs are just not as up to date as other diagnostic labs are.
For sure. That's really interesting too. That's good to know, I guess, about that exam because it's very like hot. Like you'll see all these YouTubers. I think they're like sponsored to take it, but promoting that. And then for a final question, I think we kind of went through this a little bit, but are there any other interesting cases that you've shadowed over the years and would feel comfortable sharing with our listeners? And it's fine if they're, because I know both of you already shared one, so I kind of skipped ahead earlier. But are there anything else or any takeaways from genetic counseling that you'd like to share as well?
Yeah, well, I mean, I've also seen a lot of adult patients kind of getting genetic testing and, they're like, oh yeah, I've had this for a long time, but, I don't know why. So it's like when we kind of give those results or give those conversations to people, it's really nice to see as well because they're like, oh wow, like I never would have thought about this. I think that's something that's really, important for me going into genetic counseling is the patient education aspect of it. That's kind of what's driving me to keep going for it. And that's, I think that's my main point is it's a growing field again. And I actually see it possibly being utilized a lot more as more people get into the field and kind of understand what genetics is and what genetic counselors can offer too.
I don't think I have any other cases that are interesting, but yeah, I definitely think genetic counseling is a field that is growing and we need more genetic counselors on a regular basis. They're very in demand. And I'm also really passionate about increasing the diversity in our profession itself. So 90% of our profession is made of white females, and that is definitely problematic if you consider the population of this country. So I'm really passionate about diversifying the field and mentoring people who are interested from all different countries, all walks of life, interested in becoming a genetic counselor, because I find that when you have more representative healthcare providers, it just leads to better healthcare for the patients. So if anybody is interested or anyone has any questions, definitely reach out to me. I would be more than happy to help.
No, and I think it's just so nice to see both of you connecting over something like social media, and finding support and getting into a track like this. I think that's step number one, and the fact that you have a platform like your Instagram or your YouTube channel, and then Gagan's the team member of Brown Girl Health as well, so that's amazing. And I think just having both of you there and very vocal about what you're doing makes such a huge difference, because one, I didn't know about the field that much until this podcast or until actually meeting Gagan. And I think just having a platform to share it and to getting the word out there that this exists, because a lot of the times, especially in the South Asian community, you're going to medicine or engineering, there's no other amazing fields out there, and just knowing them makes a huge difference. And sometimes we don't know about amazing ones like genetic counseling.
Exactly, and I learned so much about genetic counseling today from the both of you, so thank you so much, Aman and Gagan, for taking the time to join us today and providing us with so much valuable information about genetic counseling. If you haven't checked out Aman's Instagram and YouTube, make sure to go follow at Aman Overshares. Thank you for tuning into the Brown Girl Health podcast. You can keep up with us by following us on Instagram and Twitter and subscribing to our YouTube channel. Our Instagram handle is at brown.girl.health and our Twitter handle is at bghtweets. See you next time.